February is dedicated to heart health awareness, but we decided to take a look at another subject close to our hearts, heartburn. Severe heartburn and a heart attack can be hard to tell apart. Even experienced doctors can't always tell the difference from just a medical history and a physical exam. That's why they often order tests to make a determination. If heartburn turns out to be the culprit, you may be referred to a gastroenterologist for a workup. Sometimes called GERD for gastroesophageal reflux disease, heartburn can be a burning sensation in the upper abdomen which may move to the chest. Can occur after eating or while lying down. It may awaken you from sleep, especially if you have been eating within 2 hours of going to bed. It can be relieved by antacids, and it can be accompanied by a sour taste in your mouth or a small amount of stomach contents rising up in the back of your throat. The specialists at Advanced Gastroenterology and Surgery Associates talk to us about how they treat their patients with GERD.
We all reflux to a certain extent. I think lifestyle sort of exacerbates it. If you eat a pizza or fried foods, fatty foods, you'll get a little bit of reflux. But some people get it much more often. The medications, however, that we have actually just control the acid. They don't really prevent the reflux of gastric contents. That's why the anti-reflux measures are very important. So elevating the head of the bed is extremely important. We normally recommend 6 to 8 inches with blocks or a wedge. And of course as well, not lying down after eating, because you want the stomach to empty at least 3 to 4 hours after a meal. You shouldn't lay down, because then you sort of increase the chances of reflux of gastric contents. If you speak to a patient that has had significant acid reflux, and then they present and say, I don't have that symptoms that much anymore. It actually feels a little bit better. You have to suspect the possibility of Barrett's esophagus, because the body's way of changing the lining of the esophagus to look like the stomach, which can handle acid. So the patients get less symptoms because the lining has changed to look like the stomach. So it's sort of the body's protecting itself. However, when the cells undergo change, there's a risk of carcinogenesis and developing cancer. So even though the body's trying to protect itself from the symptoms, ultimately it can lead to problems down the road. Anyone who has a chronic history of acid reflux should probably have an endoscopy to look to make sure they don't have this change in the lining of the esophagus. But if they have this change in the lining, then we do surveillance endoscopies, and that way we can sort of prevent them from developing adenocarcinoma of the esophagus.
For more information on Advanced Gastroenterology and Surgery Associates and their services, please click the Heart of the Burn story link icon on our homepage, yourhometownhealth.com.